Has someone you love started showing subtle but concerning changes over the past year? Many people assume that death in old age happens suddenly, but the truth is that the body often sends quiet warnings months, sometimes even a year, before life reaches its final stage. The problem is, most people miss these signs because they seem small at first. It's only later, looking back, that families realize the clues were there all along. But by then, it's too late to prepare. Too late to make those last memories count. In this video, we'll discuss 5 key signs that often appear a year before an elderly person passes away. Some of these may be things you've noticed but brushed off as just part of aging. Others may be changes that seem minor, but actually signal the body's gradual decline. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and, most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time you have left with those you love. Now, let's get started. Number 1. Significant weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is unintentional weight loss. At first, it might seem subtle, like a belt that suddenly needs tightening, clothes that appear looser, or an appetite that begins to fade. Many families dismiss it as just part of getting older, but the truth is, losing weight without trying is rarely a good sign. It often indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. Aging naturally leads to some loss of muscle, but when it happens too quickly, it's a sign that something deeper is occurring. The body may be struggling to digest food properly, or the person may no longer be able to process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement more difficult, it increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections. Another reason for weight loss in the final year of life is appetite changes. Many elderly individuals simply don't feel hungry the way they used to. Their sense of taste fades, food no longer seems enjoyable, and they might start skipping meals or eating much smaller portions. This isn't just a matter of preference, it's a physiological change. The body senses that it's beginning to shut down and no longer signals the brain to seek food as often. The result? Less energy, less strength, and a gradual decline in overall health. Underlying medical conditions also contribute to weight loss. Conditions like cancer, heart failure, or kidney disease can begin progressing long before more obvious symptoms appear. Even depression or cognitive decline can lead to reduced eating, causing a downward spiral where the body isn't receiving enough fuel to sustain itself. Some families try to solve this by encouraging their loved ones to eat more, offering favorite foods, or supplementing meals with protein drinks. But if the weight continues to drop despite these efforts, it's important to recognize that the issue is not just diet, it's the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This is not just about physical appearance, it's about the body sending a message. Understanding that message now can help you prepare for the road ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Number 2. Extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that doesn't go away with rest. It's not just feeling a little tired after a long day. It's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room requires effort, and activities that once felt routine, like cooking, dressing, or even holding a conversation, start to feel too draining. This isn't just a result of aging, it's a sign that the body is conserving its remaining energy. As organ function begins to slow, the body starts prioritizing what's most essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get the same level of oxygen they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to sustain the same level of activity they once enjoyed. Another key factor is metabolic slowdown. The body is designed to produce and use energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling movement, the body shifts toward preservation. This is why someone in decline may start sleeping more, needing longer naps during the day, and finding it harder to stay awake for long periods. Some may even experience sudden drops in energy, where they seem fine one moment, but completely drained the next. Perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Many seniors who once took pride in their independence begin feeling frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't care, but because they simply don't have the energy. This can lead to a cycle of isolation, which only accelerates the decline. For families watching a loved one go from active and engaged to exhausted and withdrawn, it can be painful. It's easy to assume they're just being lazy or need to push through it, but the reality is that forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice a loved one experiencing deep, ongoing fatigue that isn't relieved by rest, take it as a sign that their body's going through a major transition. This is the time to cherish conversations, create moments of peace, and support them without expectations. Because in the end, what matters most isn't how much they can do. It's that they feel loved, understood, and at ease. Number 3, increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most striking changes can be seen in how they think, communicate, and interact with others. You may notice that someone who was once sharp and engaged starts to forget things more often, struggle to follow conversations, or seem disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even when they never had memory issues before. These subtle cognitive changes can happen months or even a full year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a steady flow of oxygen and nutrients to function properly. But as circulation weakens and the oxygen supply to the brain decreases, cognitive function starts to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they've known for years. In some cases, they may even have brief moments of lucidity followed by sudden episodes of confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might notice them speaking less, engaging less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones, it's that their brain no longer processes emotions and engagement the same way. Conversations become tiring, loud environments feel overwhelming, and eventually, many seniors retreat into their own world. You may also notice changes in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated. Others seem unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a personality shift. It's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations in the way they used to. For family members, this stage can be especially difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like losing them before they're actually gone. But it's important to remember, this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, more confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, cherish quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful. Because even when words fade, love and comfort can still be felt. Number 4. Frequent infections and slow healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. You might notice that someone who rarely got sick before now seems to catch every cold, every flu, every small infection that goes around. What used to be minor illnesses now take much longer to recover from, and simple wounds, like a small cut or bruise, heal at a noticeably slower rate. These changes aren't random. They're signs that the body is no longer able to defend or repair itself the way it once did. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently or take a long time to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because, as circulation slows and organ function declines, the body simply doesn't respond to treatment as well. Another overlooked issue is chronic wounds. If you notice that small scratches, sores, or bruises aren't healing properly or keep reopening, it could mean circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, making healing much slower than usual. Pressure sores, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final year of life often don't look the way we expect. Instead of a high fever, an elderly person may simply seem more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first warning sign of an infection, even before other symptoms appear. Recognizing these changes early can make a difference in how much comfort and support they receive in their final stage of life. For families watching a loved one go through repeated infections, it can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will fix the problem. But at a certain point, the focus often shifts from curing to comforting. Making sure they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medication that only prolongs suffering. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes can start subtly, but over time, they become more pronounced and more frequent. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears start feeling cold to the touch. The skin may appear pale, bluish or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs and reducing circulation to the extremities. It's a clear indication that the heart is not pumping as strongly as before. Some people also experience more shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting position might cause them to feel winded or out of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they were once able to walk across the room easily, but now struggle to do so, their lung function may be declining. In some cases, fluid buildup in the lungs can make breathing more difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but in elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the focus shifts toward comfort rather than trying to fix the issue. If you notice these signs, changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention. These are often indicators that the body is conserving energy and that circulation is slowing down. It's a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can give them isn't medical intervention. It's comfort, dignity, and the knowledge that they are not alone. Final thoughts. As we come to the end of this video, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all happen at once, and they may not always be obvious at first. But when you start noticing them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the best thing we can do is listen to what their body's telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death. It's about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you are not alone in this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.